in just a moment, but our health department has said that our metrics support us taking this next step in our opening and lifting the mask mandate. This move will put us in line with the state's mask guidelines and current CDC guidance. And this means that masks will still be required on public transportation. They are still required in our schools, childcare, and healthcare settings. And so the mask mandate means that in those public spaces, yes, but I want you to know, again, on public transportation, this is very important, so please don't jump on the bus without your mask on and have our drivers have to say something to you about that. But on transportation, in schools, childcare, and healthcare settings, they still must wear the mask. And let's continue to do what we can to stay safe and to make sure that everyone is safe as well. And I ask you also with the mask to please also remain respectful of our neighbors. Let's do as we've done this whole time. For those who are not comfortable taking off their mask, let's be supportive of each other. You don't know what a person has gone through. And so if there's a person who is uncomfortable removing his or her mask, please, let's remain respectful of everyone. And after the burden of this pandemic it's placed so much strain on us, reaching this point I know brings a sense of relief. But the best way to finally put the pandemic behind us all is to get vaccinated. So this part of the segment is me telling you that even though we are in a much better posture, you must get vaccinated. And we're going to have to continue to spread that word as well. And so thanks to the hard work of our health department and Office of Emergency Management, the COVID vaccine is easier to get than ever before. And so I want Prince Georgians to be in the ranks of those who are proudly protected. You not only protect yourself, but you do continue to protect those that you love. And so please, if I can ask you, do not put Prince George's County in a posture where our vaccination rates are staggered and they are stagnant and we're behind others. Let's make sure that Prince George's County, just as we have done throughout this pandemic, that we continue to do our job in getting vaccinated. We want to continue to see the numbers of individuals who are vaccinated rising. We don't want it to stagnate. It's so important that we will not be left behind. Our vaccination efforts, I want you to continue to move forward successfully. In fact, as of today, 327,348 residents have been fully vaccinated. And we have administered over 707,000 vaccines. And at all of our vaccination sites, you should know, of course, that we are vaccinating individuals who are 12 years old and older. And I want to encourage all unvaccinated people who live or work in Prince George's County to please get vaccinated as soon as possible. We're trying to make this as easy and convenient as possible. So you can just walk into our clinics. You do not need an appointment to do so. It's very easy for you to do. It does not take a long time. And information on clinic hours and locations, as well as a vaccine locator, can be found on our website, which is mypgc.us/COVID vaccine. And so we're going to continue to provide that information for you. And if you prefer to schedule an appointment rather than walk up, you can also do that if that is your preference. And again, that's mypgc.us/COVID vaccine. Our vaccine distribution and education initiative efforts are also gaining steam. And the reason that this is necessary is because we have reached a point where the supply for the vaccine has outpaced the demand. And so we are really doing everything we can from the government standpoint to make sure we're not waiting for you to come to us, we are actually coming to you. And so this vaccination distribution and education initiative has been gaining steam, and I want you to know that if you see canvassers at your door and they're knocking on your door and they're easy to identify, they will have on the vest so that they can be identified, but it's so that you know that if you are unvaccinated, please know that the county executive is looking for you. To urge you, to give you the information, to help you register for your vaccine. And we are doing so, really, we are prepared to make 266,000 plus visits to your home. We're knocking on those doors. We're also making 1.3 million calls and sending out over 500,000 text messages. So let everybody be on the lookout to know the county executive is looking for you if you are yet unvaccinated. And our teams have been met, I have to tell you, with overwhelming gratitude. People have been so kind to them as they've approached those doors. The relief that people feel is that we are coming to Prince Georgians because we believe every Prince Georgian matters. And so if you're not able to come to us, don't have the information you need, we're coming out to you. And so our residents have been thankful that the government is meeting them right where they are, where they live, to extend the hand to them to be vaccinated. So far, our canvassers, and I've met with these canvassers, and I'm going to tell you, you have a good crowd who are coming to your doors. They're pumped up about this. And so far, we've reached 30,000 Prince Georgians, not only with vaccination information, but this is so great. I want you to know that as we approach the doors, we are not only offering information about vaccine, but we are also there to provide resources to help support families who have been economically devastated over this year. So that means we're providing information about rental assistance. We've already shared that with over 2,146 families. We are providing information on that door about temporary unemployment benefits. At the door, we're also providing information about access to food distribution sites. We're talking to you also about access to vaccination sites and appointments. So we're providing more than just vaccine. We're also providing critical resources to families. And so we are only about 50% through our first Canvas Pass. We'll continue this effort through July. And please, everyone, continue. We've heard wonderful stories about how well our canvassers have been treated, but please continue to treat them with kindness as they come to the doors. They are trying to help and to provide critical information. And remember also, for your safety, that they will always have on a bright yellow vest and identification badge to show that they are a part of our county vaccine outreach team. So that's for you to know that as those persons approach, if they are not wearing the yellow vest and they don't have that identification, they are not a part of the vaccination team. Now, rental assistance, I want to remind everyone that we have relaunched our emergency rental assistance program. We have millions of dollars still available in funding, and more is coming down the pipeline thanks to the American Rescue Plan. Our tenants are encouraged to reach out to their landlord to apply for funding on their behalf, and all approved applications will have funding sent directly to the landlord to pay back rent on behalf of the tenant. And so if someone's landlord does not apply on their behalf, tenants can also complete an application on their own. The Department of Housing and Community Development has partnered with a number of nonprofit community organizations to assist landlords and tenants with completing and submitting the applications. And all the information you need is available on the Department of Housing's website at hcd.mypgc.us, hcd.mypgc.us. You should be reminded that there are also eviction moratoriums that are in place for those whose income was impacted by COVID-19. Those will remain in place while the state of emergency continues to be in place. And if someone believes that they're facing an unlawful eviction, there are several community organizations that provide free legal help and representation. And that information about evictions and the organizations that can assist can also be found on the Department of Housing's website, which again is hcd.mypgc.us. Let's do that again, hcd.mypgc.us. I want to talk to you next about the Summer Passport Program. I began discussing this with you a few weeks ago, and again, we are all in this together. Whether we have children or not, I want all of our young people to know that they have not been overlooked during this time. This has been a most trying time for our young people, and I know that the circumstances around this pandemic have really been hard on our young people. And as we head especially into Memorial Day weekend and the coming summer months, we're looking for opportunities to make sure that we're engaging our young people, that they can socialize in a safe, supervised setting. This is critical to their development and their health and well-being, and it's critical to our communities as well. And so we're working to finalize the Alsobrooks Summer Passport Program. I'm excited about this. This will give our youth ages 12 to 18 throughout the county a variety of summer programming and the variety of safe and fun options to choose from this summer. And the program will operate from June until August, and it offers a number of day and evening events for our young people. So get excited, young people. Know that we have not forgotten about you. And a few of the engaging activities for our youth will include a 3-on-3 basketball tournament, a bowling experience, and there is also a Six Flags experience with both an educational component as well as an entertainment component. We're also planning an educational opportunity from the plumbers and steam fitters unions. We want to thank them for their partnership. They will be teaching trades to young people that can open their eyes to entrepreneurship. So we're developing some entrepreneurs this summer. Additionally, we're looking at having a beauty and nail experience, educational experience, as well as a cyber security and drone camp. And so a wide variety of activities to appeal to the interests of all of our children. And we're still finalizing the final scope of activities, but we look forward to rolling out all of these opportunities starting next month. I am also excited to announce something that I urged to happen, and I want to thank them for doing so quickly, the start of our summer movie experience. So if you see Betty Hewlett, otherwise known as Elizabeth Hewlett, who's chair of Maryland National Capital Park and Planning, or if you see Bill Tyler or the entire team at Maryland National Capital Park and Planning, please give them a huge thank you for pulling this together for us, and they did so again in a quick time frame. But we are proud to announce that starting on June 4th, we will begin our movie night in partnership with Maryland National Capital Park and Planning and at the Prince George's Stadium, home of the Bowie Bay Sox. And so we have plans for 4 different movies so far, with space for 100 cars, and the tickets are $30 per car and are on sale now. And the first movie for the evening of June 4th will be The Avengers. So you can purchase those tickets at pgparks.com/Baysox movie tickets. Again, that is The Avengers movie will be showing on June 4th. And I want to remind everyone also that the Department of Parks and Recreation recently reopened a number of community centers and facilities, and they are actively expanding summer programming available due to the rapid decline in case numbers in our county. And so you can view also a list of open facilities, a list of classes, and the programs that we have available, again, at pgparks.com. Summer Youth Enrichment Program, I want to talk about that next. I'm excited about it, that our 2021 Summer Youth Enrichment Program will be open and available and has offerings for our young people. As you know, when I came into office, we greatly expanded the program. During my first year, we were able to provide nearly 7,000 jobs. We doubled the number that we've been able to provide in the past and went to 7,000 jobs to our young people. But the pandemic disrupted the normal operations of this program, and so we're still working hard to provide as many opportunities as possible nonetheless, both virtual and in person. So this year, our program will offer around 2,550 summer youth enrichment opportunities to our county's young people between the ages of 14 and 22. And as county businesses begin to reopen and increase the size of their workforce, we will continue to look for additional opportunities with our summer youth enrichment business partners. And so we're looking ever so often to make sure that we're still able to expand the program. This year, applicants were given the opportunity to choose from a diverse selection of opportunities within our signature programs. They include our energy conservation program, where our youth will get a deeper understanding of STEM thinking and energy efficiency. We have an aviation program that will give participants a view from the aviation career path from professionals working in the Federal Aviation Administration. Our trade certification program will give participants an opportunity through Prince George's Community College to learn careers in HVAC maintenance, medical billing, automotive technician, and IT help desk careers. And our Stand Up and Deliver program will have participants working at our food distribution hubs throughout the county. So this year, we also have a new feature, and this feature is called the Talent Pipeline Program, which focuses on providing a career path towards entry-level opportunities for our youth ages 18 to 22. And since February, the Talent Pipeline Program has employed 60 young people who are gaining valuable work experience while assisting some of our county's agencies. And in fact, some of you may have interacted with these young people who are employed at our vaccination clinics and through our health department to assist with contact tracing. So we have a lot of new programs to be excited about this year. We know our young people are also excited, ready to get out, enjoy the weather, and come on out the house. And so we've gotten a lot of interest already, and we've received more than 7,700 applications during the application period earlier this year. So if you sent in an application, please check your emails regularly for placement offers, as offers have already been made and are continuing to go out through the end of this week. And so I want, again, every family to know that we will do everything we can together. This is such an important point. Please do not overlook these young people this summer. Please remember that they have really had a very tough time. They need us as a community to support them, to be present, to provide opportunities for them to be engaged constructively. And it's going to really take all of us, and not to forget any child, not just the ones 12 to 18, but these babies who are still 18 to 22, and I do mean some of them are still babies 18 to 22 who still need our support and need our guidance. And so that's what these programs are about. And if there are those who can help, who want to volunteer, who have opportunities available that you want us to know about, we want you please to reach out to us so that we can make those opportunities available to our young people. Finally, I know that we've seen an uptick in crime since the start of the pandemic. We are not immune, unfortunately, from what we have seen wiping all across the country, as there has been an increase in crime from the start of this pandemic. And we all can do something to prevent crime in our communities. That's the good news, is that we can work together. And I'm announcing that starting this afternoon at 3:30, I will be doing a community walk today in Capitol Heights to meet our residents where they are, to talk about these issues. And this afternoon's community walk will also be the beginning of a community walk series. And so if you see me out and about, I'll be out there with my office, members of our police force, and members of our community government agencies. And we will join residents in our community to discuss issues like crime and other things that impact our community. And so I'm so excited about it. We'll be also hosting a town hall with our new acting chief of police. If you haven't heard, there's a new chief in town. His name is Malik Aziz, and we will soon be announcing that town hall to give all of our residents an opportunity to come out and talk to Chief Aziz. And we'll be participating, Chief Aziz will be participating as well in these community walks, and this town hall will be yet another opportunity for him to continue to introduce himself to our community, to share more details. We'll be getting those details to you very soon, but we'll be able to hear from you, to hear your concerns, to talk about our strategic plans, what our summer crime initiative, for example, will look like to make sure that we are prepared to combat crime as the weather warms up. Again, we are all in this together. And we will step up and do our part, and we're asking you to join us. And so from the beginning of this crisis, what I can tell you is I've continued to say COVID-19 would not have the final say, and we continue to stick together as a community. Prince Georgians looked out for each other, and after months of both progress and some setbacks, we had some setbacks too. We have finally seen the end in sight. We can now see some light at the end of the tunnel, and we have a ways to go until our county can finally completely put the virus behind us. But until then, we are working to return every day to some sense of normalcy in our community. We are so excited about it, and again, so grateful for what you have done to help us get here. So thank you, thank you, thank you for your patience. I want to thank you for your understanding. I want to thank you for your vigilance. I want to thank you for holding us accountable. I want to thank you for every sacrifice that you made. And so we're going to keep working to make sure that everything we lost during this pandemic, we will regain together. That is our health, healing. I want you to participate with me in making sure that we are taking care of those who are vulnerable. I want you to participate with me in supporting our kids and getting them through this, because they're not through it yet. We still have a lot of work to do, so please help us to wrap our arms around our kids, to help them have exciting summer opportunities and programming. And also, please remember to look out for one another. Again, we are lifting the mask mandate, but please be respectful of those who are not yet comfortable removing their mask, remembering that this was very traumatic for so many in our community. The health officials tell us that it is safe for us to make this decision, but it does not mean that everyone will be able right away to shift into it and to feel comfortable. So we do want to continue to be respectful and to look out for each other. So at this point, I'd like to turn this over to Dr. Askew for his update. Thank you.
Thank you, Madam County Executive, and thank you so much for your inspirational and steadfast leadership through this. And most of all, thank you for listening to the science. Because you listened to the science, you saved untold numbers of lives, and greatly appreciative of your leadership. And it's been an interesting and fun, I shouldn't say fun, it's been a challenging but interesting ride. So good afternoon, everybody, or good noon. I think it's just about noon right now. The COVID virus is getting under control. More and more people are getting vaccinated. The county is closer than ever to ending the pandemic. So I want to begin with an update on what's actually happening here in the county right now. I'm happy to report that cases keep going down in Prince George's County. The county executive mentioned we had fewer than 500 cases the week ending May 15th. And I can tell you further that early numbers for last week indicated we are on track to have even fewer cases in follow-up. One of our key metrics is our cases per 100,000 per population per day. And that number now is 4.8. That is the lowest since the start of the pandemic. The lowest since the start of the pandemic. This shows the spread of COVID in the community has slowed down considerably. Hospitalizations have seen a 60% decrease in the past month. As of yesterday, 57 people were in county hospitals with COVID-19. That's roughly 100 fewer patients with COVID-19 than only a month ago. The amazing work of our hospital systems have saved so many lives. They continue to provide the best care for those who have COVID and other ailments. Just 5% of the county's total bed capacity is now in use by patients who have COVID-19. This across-the-board improvement in key indicators show we are ready to accelerate on the road to reopening. What's also giving us confidence to move forward is the work we've done together as a community on getting vaccinated. Prince Georgians have stepped up when we needed each other most. As you know, adolescents are also now eligible to get protected against COVID-19, and more than half, 55%, of residents 12 and older have received at least one dose of vaccine so far, and that number jumps to 60% when we look at our adults 18 and over. Meanwhile, we continue to further protect those most at risk for severe COVID illness and death. More than three quarters of residents 65 and older have had at least one dose so far, over 3/4. The more people who are vaccinated, the harder it is for the virus to survive and keep spreading from person to person. Our drop in COVID-19 metrics show we are winning the battle against COVID. Every vaccination counts, however, and every shot in the arm gets us that much closer to actually ending the pandemic. On Friday, we take another exciting step forward by lifting the mask mandate in most places. Of course, as mentioned before, except in schools, childcare, and healthcare settings, and on public transportation. However, if you are not fully vaccinated, we ask that you continue to mask up for your safety. COVID-19 has not completely gone away. You are fully vaccinated when it has been 2 weeks since your second dose of Pfizer or Moderna vaccine, or it has been 2 weeks following a single dose of the Johnson & Johnson vaccine. Even though social distancing and mask wearing will not be required, many of you will choose to do so for a variety of reasons, and that's perfectly okay. While I am happy to report that hundreds of thousands of Prince Georgians have been vaccinated so far, the county and its partners are still working hard to get as many people protected as possible. Our mobile vaccination units are out and about every day, giving shots to homebound residents and to those at apartment complexes, especially in targeted zip codes that need some help in improving vaccination rates. In addition, our community partners across the county are setting up pop-up clinics each week. More and more pharmacies, hospitals, and doctor's offices are providing this free and life-saving vaccine to residents each day. Our focus is shifting to a more localized approach. We are bringing the vaccine to the community and making it easier than ever to get protected. To meet this shifting demand and to plan for a post-pandemic world, the county is closing two of our large-scale vaccine clinics. The Cheverly Health Center vaccine site closed last Friday, which allows the health department to prepare for school immunizations and ensure the continuity of other vital clinical services for residents. And the Laurel Beltsville Senior Activity Center vaccine clinic will close at the end of the day on Friday. This is in line with the county and state plans to reopen and safely resume services and activities at senior centers and recreation sites, and is another step forward in our reopening of the county. The Southern Regional Technical Recreation Center in Fort Washington and the Sports and Learning Complex in Landover will continue to offer vaccines with a capacity of 2,500 per day if needed. Our 3 mobile vaccination clinics, of course, will continue to operate as well. To make it even easier to get vaccinated, our county vaccine clinics now accept walk-ins. No appointment is needed to get protected. No appointment is needed to get vaccinated. Just walk up and walk in. Please know that those who are under 18 currently still need to have a parent or legal guardian with them at the clinic to provide consent. If you would like to have an appointment to get your vaccine, not a problem. Book it now. Go to our website, mypgc.us/COVID vaccine. Once you are there, schedule your own first dose appointment. You can also call 311, press pound, and someone will help you get that appointment. Your second dose appointment will be scheduled during your first dose. Again, or you can just walk in. It's as simple as that. Please tell your family and friends to go out and be proud to be protected. The vaccines provide excellent protection against serious illness, hospitalizations, and death due to COVID. Remember, feeling side effects from vaccines is normal. So don't be surprised if you feel a little achy or tired following your injection, or some of you may even feel a little nausea or may get fever. It'll go away in a day or two, and I also urge you to talk to your friends and family and colleagues who've had the vaccine who can tell you exactly what their experience was. Finally, this is a tremendous day, and once again, I want to thank you, all of you, Prince Georgians, for following our advice, looking out for each other, and getting vaccinated. Thank you.
All right, so with that, we'll take any questions. Will, good morning, afternoon.
Yeah, afternoon. Alsobrooks, quick question, please, and Dr. Ashley asked a quick question. The neighbors to the south in Virginia, I don't know if you heard the rhetorical debate, and one question was asked, would you recommend businesses to make customers have to show some type of ID or any mass crime? Would that be a recommendation you would have?
Well, you know what, we want businesses to feel free to put in place whatever measures they feel are necessary to keep their customers safe. Some businesses may decide, for example, that they want to require that a mask be worn by either employees or people who are patronizing those businesses, and we're comfortable with businesses doing what they feel is necessary to protect the workers in those businesses and to protect their customers. And so I don't know whether Dr. Askew, if you want to say anything about a card. I don't know about a vaccination card. Everyone doesn't have the vaccination card yet, so that may not be as easy to do. But I certainly want to make the point that we certainly support businesses doing what's necessary to keep their employees safe and to keep their customers safe.
Dr. Ashley, just a quick question. This is something I asked you before, more of an update from my association. There's a few residents who chatted with who have gotten, most have gotten vaccinated. There's been still a few who have not, and they'll be waiting. They literally are waiting. I'll get Pfizer or Moderna, don't want Johnson. There's still hesitancy. Could you explain why it should?
Sure. I will say that I can understand why there's hesitancy, and I want to respect and know that we respect folks who are hesitant, but our standing has not changed. The vaccine that is best for you is the vaccine that is offered to you and available to you at the time you're there at a vaccine clinic. The one thing that's great now, I think, for folks is that there's enough vaccine in circulation that if folks are waiting for a particular vaccine, they can probably find a place immediately that will allow them to get the vaccine that they feel most comfortable with. But again, my advice, the vaccines are safe at preventing serious illness, hospitalizations, and death. And if you want a life-saving elixir, get the vaccine that's available to you when it's available, no matter which one it is.
While you're there, again, not interrupting. While you're still up there are still deaths being announced by the state, county, every day. There are still people in the hospital. Do you know yet if those people are all unvaccinated, like the deaths and the sicknesses? Do you have any percentages on? I mean, we know that the vaccines are 100% right, supposedly 100% preventing death, so presumably. Do you know if those who are becoming sick and those who are dying are unvaccinated?
Sure, I don't have the county data at hand, but I'd be happy to have us dig through that and find out. I can tell you that overall, of course, people who are vaccinated are much less likely to be hospitalized, be severely ill, or die, and that's proven out effective proven out to be true across the country. We know for ourselves, we're reporting fewer and fewer deaths and having more and more days where there are no deaths being reported, being reported at all. Clearly, if you look in social media, there are some things that are misinterpreting deaths among people who have been vaccinated, because it does happen occasionally. Remember, the vaccines are 95% effective. So there's still a potential that you could get COVID, get very sick, and have a poor outcome from that. But it's so unlikely. The chances are so rare and so slim that getting vaccinated is absolutely the best option for everybody during this pandemic.
Back with masks and businesses and people's behavior. We have seen some people behaving badly in places where businesses do mandate masks, but yet the mandate has been lifted by government. You've addressed it, but again, what is your message to people? Because I'm going to leave here, I'm going to go out, and you know this county, I know this county,
Yeah.
people are saying, I'm keeping my mask on a while.
Yeah. Well, I think Prince Georgians have a special respect for the virus. I don't know where you have encountered these people who are behaving poorly. I don't think they're Prince Georgians, I'm just going to say. Because Prince Georgians really do have a respect for the virus. We have been so traumatized by it. And I've heard from a lot of residents that they are not interested in removing their mask yet. And again, I'm just asking people to respect each other. Knowing that we had a year that none of us have ever seen a year like this one before. You don't know a person's situation. Whether they were sick, whether they lost a loved one, you don't know what people have experienced when you encounter them. So please be respectful of a person who says, I'm not comfortable taking off my mask, or a business. If that business says, we prefer for you to remain with the mask and to keep the mask on, sometimes it's keeping those employees safe. And again, you don't know what that business has experienced, whether a number of their employees were sickened at some point. So I think just give it some time. Let's be respectful of each other. We will make it through this, and this won't last forever. Even the mask wearing, we're still in it. As Dr. Askew mentioned, we still have people who are becoming sick with COVID. There are still people who are becoming very sick with it, and some who are dying. So it's not over yet. So we do have to remember that.
I wonder if you could talk a bit about why it is that Prince George's vaccination rates are still lagging the state, and if you had any concerns about that and about lifting the mask mandate because of that.
So at this point, the supply is there. For a long time, we were concerned that our rates were lagging because the supply was lower. The supply is there. The resources, we were out, as I mentioned, actually knocking on doors, canvassing, calling. We have the mobile units. We're going to people's bedside. And so it is certainly not the case that we are unvaccinated because the supply is an issue or the infrastructure. We do have a number of people who, for whatever reason, remain uncomfortable with a vaccine or who have not gotten vaccinated, and we're urging those people to accept the information and education that we're giving them. We're prepared to answer questions. In other words, it is my posture that even those who are reluctant deserve to have the vaccine, and that we will continue the education campaign. We're going to take the vaccine to them. Like I told you, if they don't come to us, we're going to them. Dr. Askew mentioned we closed down 2 units because we think it's just that important. So we will continue to get those vaccination rates up. But that's why this press conference is important, so that people know. Ask the people you love, check in with them, and ask whether or not they have been vaccinated, and please urge them to go do so if they have not. It's so easy to do. It's quick, it's painless, and it's life-saving.
You didn't have concerns about lifting the mask mandate because the vaccination rates are lower?
No, you know what, because we have the, and Dr. Askew can answer, but we are now below 2% positivity rate, where the infection rate is low, the hospitalizations are low, so all of our numbers and metrics tell us that it is safe for us to make the decisions that we've made. And Dr. Askew, if you want to add anything else, it'd be great.
Absolutely. I think the county executive is spot on. I think she's earned her honorary PhD in public health throughout this. The metrics are telling us, the science is telling us that we're at a vaccination rate that makes us quite comfortable with lifting the mask mandate. Our neighboring communities, as you know, our borders are fairly fluid. All are also in good shape, and so we feel comfortable with that being the case, because many of our folks go out of the county to work. We know that the vaccine is very effective against the variants. We know it's showing to be proven to be effective against the spread of COVID now. So all of the things, all of the science points to this being a time where we can make this decision and move forward.
I just want to add that based on what we've said today, and because the mask mandate is new, lifting it, and that there may be businesses who still require it, that we do still encourage people to just take your mask with you, carry it in your pocket, carry it in your pocketbook, whatever. Just people, we do still advise you for those occasions where it's required to make sure that you still carry it with you.
Thank you, everyone, so much.
Thank you.
Speaking of